Welcome and thank you for choosing Ronald Reagan UCLA Medical Center for your care. This video provides pre-operative instructions on what to expect before, during, and after your hospital stay. You can be assured that you'll be cared for by expert surgeons and professional and compassionate nurses and staff. A primary goal of this video is to provide you and your family with information so we can work together and collaborate to bring you great medical care.
Preparations for your surgery begin before you come to Ronald Reagan UCLA Medical Center. First, please schedule a visit with your primary care doctor to have your preoperative history and physical exam performed and preoperative laboratory tests drawn within 30 days of your surgery. The orders for these tests will be faxed to your doctor's office by your care coordinator. If you are under the care of a specialist such as a cardiologist, pulmonologist, or hematologist-oncologist, please ask your surgeon if additional preoperative evaluation is necessary. Your preoperative packet will be sent to you to review with your loved one. This packet includes a personalized letter summarizing the coordination of your preoperative appointments and tests, a preoperative information document, a document called Your Road to Recovery containing information essential to your hospitalization and care, the admission medication history form, the pre-procedure treatment unit medical history form, and a preoperative checklist created specifically for you as a reminder aid. It is absolutely essential that you read through this packet and fill out any necessary paperwork before your surgery. You will be asked to sign a consent form affirming you have discussed the benefits, risks, and alternatives of surgery with your surgeon. We will also ask for your consent for a blood transfusion if necessary. If you choose not to receive blood under any circumstances, you will also be asked to document that choice. If you would like to donate your own blood for surgery or designate a directed donor, discuss this with your surgeon well in advance of your surgery. If you have an Advanced Healthcare Directive, please bring a copy with you. An Advanced Healthcare Directive is a legal document that states your medical treatment wishes and allows you to appoint someone to make your healthcare decisions for you in the event you are unable to do so yourself. If you do not have an Advanced Healthcare Directive, you can print one out on our website, uclahealth.org. We can also give you one at the hospital. Please complete the admission medication history form and send it to your care coordinator. Also, bring a paper copy with you on the day of your surgery. Remember to specify the dose and frequency for each medication, including supplements and herbal medications. Designate one family member or trusted friend to serve as your contact person and coach. Their role will be to support you as you prepare for surgery, through your hospital stay, and during your recovery at home. This person should be present when you receive your final discharge information from your healthcare team. If you are taking aspirin, non-steroidal anti-inflammatory drugs, or other blood-thinning medications, please contact your surgeon's office regarding the management of these medications. You may need to stop taking these drugs at least 7 days before your surgery date. If you are taking medication for diabetes, discuss with your doctor how to manage them prior to your surgery. If you are taking medication for high blood pressure in the afternoon or evening, you should take them as prescribed by your doctor the day before your surgery. If you are taking medication for high blood pressure in the morning, continue them as prescribed with the sip of water. If you typically take medication for seizures in the morning, take them with the small sip of water on the day of your surgery. If you are having surgery for a movement disorder, do not take your movement disorder medications after midnight the night before surgery. Do not bring medications from home unless specifically instructed to do so. You should discuss your medication plan with your surgeon for more specific conditions not outlined here. You do not need to cut your hair prior to surgery. We recommend that you wash your body with an antiseptic skin cleanser liquid such as Hibiclens or CHG for 5 to 7 days before surgery. If your surgery is in less than 5 days, please wash with Hibiclens for the remaining days. Please read the Hibiclens informational sheet in your preoperative information document. Do not eat anything, including gum or candy, after midnight the night before surgery. If you do eat, your surgery will most likely need to be postponed. You may have small sips of only water, Pedialyte, or Gatorade as needed to take medications until 5 a.m. You may brush your teeth and rinse your mouth, but do not swallow any of the water. Infants younger than 6 months old may have breast milk or formula until 4 hours prior to the time you arrive, and water or Pedialyte until 2 hours prior to arrival. Children between 6 months and 3 years old may have solids until 8 hours prior to arrival, breast milk or formula until 6 hours prior to arrival, and water or Pedialyte until 2 hours prior to arrival. Adults and children older than 3 years may have solids until 8 hours prior to arrival, and water, Pedialyte, or Gatorade until 2 hours prior to arrival. On the business day before your surgery, please call the Pre-Operative Evaluation Center, or PEC, at 310-319-2219 between the hours of 2 p.m. and 4 p.m. to find out what time to arrive at the hospital. If your surgery is on a Monday, please call the preceding Friday afternoon. A nurse will tell you the time to come to the admissions office on the day of your surgery and answer any questions you may have. Also notify the PEC the day before your surgery if you have limited English proficiency. We offer interpreter services at no cost to you. If your surgery is not the first scheduled operation of the day, your surgery start time may be earlier or later than originally planned. If this does occur, you will be informed. If you feel ill, please call your surgeon's office as soon as possible, as your surgery may need to be postponed. Ask your doctor if you should bring medical records to the hospital, including any test results, MRI, X-ray, or CT scans. If you have sleep apnea and use CPAP equipment, please bring your CPAP or BiPAP device with you on the day of surgery. If you use a wheelchair or walker, we will provide you one during your stay. If you have a separate insurance card for prescriptions, please bring this card when you check in at the admissions office. Please bring only essential items. Leave your valuables, such as jewelry and cash, at home or with your family. From Wilshire Boulevard, go north on Westwood Boulevard. After you pass LeConte Avenue, you will see the UCLA Medical Plaza on your left-hand side. Keep going, and the next building on your left is Ronald Reagan UCLA Medical Center. Pull up to the valet, as this is your only parking option. Enter through the main doors of the hospital and head straight down the hallway. After you pass the dining commons, you'll see Maddie's room on your left. Just next to it is the admissions office where you will check in. Please provide a copy of your advance directive, or you can fill a new one out. You will then be directed to the second floor, where you'll be greeted at the Pre-Procedure Treatment Unit, or PTU. Please, only one person may accompany you to the second floor. All others may wait in Maddie's room or at the dining commons. On the day of your procedure, an anesthesiologist will go over your medical history and answer all of your questions. After your surgery, you will recover in the post-anesthesia care unit, also known as PACU, or in the intensive care unit. Visitor access is restricted in the PACU. Family and friends should wait in Maddie's room. Our volunteer staff will keep your contact person informed as to where you will be after being discharged from the PACU. Your surgeon may also come to see your contact person after the procedure is completed. Once you recover, you will either stay in the ICU or be transferred to a neurosurgical unit room. Both include a place where one family member can sleep. These are private rooms with unlimited visiting hours. If needed, you will receive pain medication intravenously until you can safely swallow pills. By the day after surgery, you should have transitioned to oral pain medications. You will likely wake up from anesthesia with the bladder catheter in place. The catheter will usually be removed the day after surgery. Please tell your surgeon if you have had prostate issues or urinary retention in the past. You may arrive to your room with elastic stockings and a sequential compression device on. These are specifically designed to increase blood flow to the heart and to decrease the chance of blood clots in your legs. You will be encouraged to use an incentive spirometer while you are awake. This is a plastic handheld breathing device that helps you practice taking deep breaths. Being able to get out of bed and move around as soon as possible after surgery enhances your recovery. Your care team will help you get up and about safely throughout your hospitalization. Please refer to the document called Your Road to Recovery to familiarize yourself with what to expect after your surgery. Your team will discuss your discharge plans with you and your coach on a daily basis to ensure that we take care of all your needs and any questions in anticipation of your departure. At-home care, rehabilitation, physical therapy, and any other outpatient services that you may need following your surgery will be coordinated before you leave the hospital. Prior to discharge, you will be given prescriptions to fill at your pharmacy. As an alternative, you may choose to have your prescriptions filled at the hospital pharmacy. Your medications will be brought directly by a pharmacist to your room, and counseling can be performed for all new medications. Please make sure you or your coach have some form of payment for the prescription copays on the day of discharge. Future refills of medication can be done at your community pharmacy. Please have your contact person arrive no later than 10 a.m. on the day you are discharged to accompany you home. Please finalize transportation arrangements before you come for surgery. For outpatient procedures requiring an overnight stay, the scheduled discharge time is 8 a.m. Your ride should arrive by 7 a.m. If you need assistance getting home, please call our Patient Affairs Department. Your recovery continues at home. It's important to have a support system in place so you're not alone. Do not drive or return to work until your surgeon gives you clearance. You should schedule a follow-up visit, usually within 2 weeks, to remove any stitches or staples. At-home care, rehabilitation, physical therapy, and any other outpatient services that you may need following your surgery will be coordinated before you leave the hospital.
We hope that this video has been helpful in answering some of your questions about your surgery. We understand that this may be a challenging, emotional, and sensitive time for you and your loved ones, but you can be assured that all of us here at Ronald Reagan UCLA Medical Center will do everything we can to keep you safe, comfortable, and to speed you on your way to a successful recovery.